Well, I think the problem with bariatric surgery is that everybody considered is as the weight reduction surgery. But as a surgeon, we know that it is a life-saving surgery where we are not only aiming at reducing the weight, but we are also aiming to reduce or control the metabolic storm which the body is going, like diabetes, cholesterol levels, blood pressures, psychological aspects, the psychosomatic aspects. So I feel that bariatric surgery is a life-saving surgery. It's not cosmetic surgery at all. The cosmetic surgery, people confuse liposuction with bariatric surgery, which is not correct. Liposuction is just a contouring surgery. Any part of your body which needs a contouring can be done with liposuction. But liposuction is not a weight loss surgery. That is a cosmetic surgery. Whereas bariatric surgery not only reduces the weight, but also takes control of the metabolic storm and metabolic conditions. And it's a life-saving surgery. And it can be, as I said, can be compared with any other life-saving surgeries like coronary artery bypass or surgery for cancer or surgery for any other disease which otherwise could be fatal. Most of the centers, at least I can talk about in India, and most of the centers in India, bariatric surgery is very, very reasonably priced surgery. And we must understand that this is a surgery which needs a lot of high quality disposables, high quality stapling devices, high quality of anesthesia, and trained surgeons, anesthetist team. So I would not agree with anyone that bariatric surgery is expensive. If you really look the various data which have been analyzed, whatever the patient is paying for the bariatric surgery, he recovers the cost within 2 years after the operation. And after that, everything is his gain financially. Otherwise, he tend to spend so much on management of high blood pressure, diabetes, and its complications, and of course, spends on joint replacements and coronary artery problems, the metabolic problems, amputations, diabetic foot, dialysis, kidney transplants, eye complications, blindness, so many things, innumerable things. Also, the increased chance of getting a cancer. So I would say that bariatric surgery, from that point of view, whatever you pay in whichever center you pay, I think within 2 years, whatever you have paid comes back to you already. And rest of the thing throughout you the bariatric surgery becomes the mainstay for a good and well-balanced metabolic clinical condition. Bariatric surgery is like any other surgery, uh, has got a protocols, has got the indications where bariatric surgery is indicated. So if I want to explain from other very simple to understand, say, for example, if somebody has got a coronary artery which is blocked 60% or 50%, they will not go for a coronary artery bypass. The same way, if the BMI is less than 32.5, they do not qualify for bariatric surgery. We never offer them bariatric surgery. We never suggest them bariatric surgery. Bariatric surgery can only be advised for patients with 32.5 BMI and comorbid conditions like hypertension, diabetes, dyslipidemia, etc., or 37.5 BMI without any of the comorbid conditions. If the BMI is anything less than 32.5 in diabetic patients and 37 point less than 37.5 in non-diabetic patients, bariatric surgery is not indicated, and nobody will advise them and nobody will agree to operate them and do a bariatric surgery. That has got a set protocol, set standards across the globe.